Namaste, myself Dr. S.P. Moosath. When we give some advice to a parent, usually I used to say that if you are able to implement, then you try or put your first step. For example, we will say, don't give the same kind of food activities every day. Maybe everyone will be giving dosa or idli because kids will like that one side. The other side, the batter will be there in the home. So it's easy for a parent to prepare and give. And they will be saying that he likes only dosa, he take only dosa and idli. So what we advise is we should give 7 days, 7 variety of food we should give. But usually parents say that I tried, doctor, I tried to prepare upma, but he is not taking. So I automatically I have given dosa. What happens is, at what point we are giving the same food that the kid like. The point is, when we try to implement a new thing, kids will resist that, and they show the stages of attention seeking. I have already told about the stages of attention seeking. What are the 5 stages of attention seeking? So they will show the third stage of attention seeking. So if you are giving the same item in the third stage, the kids script will be like, if I show tantrum, I will get it. This is what the script they will have. So if you are able to implement, or if you are able to get a success out of that action, then only you should put your first step. So usually I used to say that that's why even our treatment also that we are doing it in our hospital is, as a parent, very difficult to implement new things to our kid. It is very difficult even for me to control my kid. Why? Because in the starting stage of implementation we will be using our logic, because doctor told this is the fact and figures will make you to, or your knowledge is making, or your head is taking the decision that this is not correct, this is good, when we start that action. But when we see that stages of attention seeking and the behavioral issues and some tantrums from our kid, we will lose our logical thoughts, then our emotions will work. That's what we see till now. Even if the parent is trying to implement that thing, after some time their logical thought will goes, and the emotions, today let me give this, tomorrow onwards I will try it. This will not happen. For this we need a help of a third person there, a treatment protocol or a help of a third person, because we need to control the parent mindset also, then only they will be able to implement that to the kid. And when they see the change, positive change, they will be able to continue it. So 21 days, if we practice that, it will be a habit, so that parent can implement or continue it after going from here also. That's why even for me it is very difficult to implement a new thing to my kid. Somebody should control me for that. So same way, a parent should think of a third person to control them. There, a doctor's advice or doctor's presence needed. So let's see what happens. So it should not be like, we should not go ahead along with the kids' likes and dislikes. When they reach at the age of 10 or 12, we will not be able to satisfy their likes. Then only we will search for a counseling center to have a change. So nobody should get that situation. Before that itself, we will drive them in the positive direction. Namaste.